Let's talk about lumbar spinal stenosis and how the disease develops. Lumbar spinal stenosis most frequently involves the lower three lumbar vertebrae. It is characterized by the narrowing of the spinal canal or the intervertebral foramen, which may ultimately affect the nerves passing through them. This is a region where space is limited, so space-occupying lesions or congenital narrowing of the neural arch will lead to a similar presentation. The most common cases are related to an aging spine. The most common cause of lumbar spinal stenosis is termed degenerative lumbar spinal stenosis. Affecting those over the age of 55, this condition is caused by several age-related and post-injury sequelae leading to mechanical compression of the spinal nerves. As the spine ages, its morphological characteristics degenerate in a predictable manner, but genetic and lifestyle factors make each case unique. We often hear about the condition called degenerative disc disease. Contrary to the way it sounds, this process has been shown to occur in normal aging spines, present in most people including those who do not present with back pain or nerve symptoms. As the individual ages, their discs naturally change from tall and plump structures with high water content to stiff and dehydrated flatter cushions, a process which is hastened by previous disc injuries. It has been hypothesized that further signs of spinal degeneration are a result of the loss of disc height. There are three major types of degenerative spinal stenosis, classified by the anatomical location of nerve encroachment. Central stenosis, the most common of the three, is when the central portion of the spinal canal is obstructed by the degenerative changes associated with spinal stenosis. Disc bulges, end plate bone spurs, or hypertrophy of the facet joints, ligamentum flavum, or the posterior longitudinal ligament all can obstruct the limited space in the spinal canal. Due to its central location, central stenosis frequently affects the spinal nerves on both sides and therefore presents with bilateral symptoms affecting multiple nerves depending on the segmental levels that are involved. Lateral recess stenosis refers to the obstruction of usually a single nerve just prior to its entrance into the neural foramina. Disc bulges, herniations, as well as bony outgrowths from the vertebral end plates or hypertrophying facet joints will affect this region. Due to its more lateral location, the symptoms associated with this condition are usually unilateral. Foraminal stenosis refers to the obstruction of a nerve root within the space of the neural foramina. The likely culprits for nerve encroachment in this scenario are degenerative changes involving disc space narrowing, end plate osteophytes, and facet joint hypertrophy. As in lateral recess stenosis, foraminal stenosis most frequently affects a single nerve. The L5-S1 neural foramina is typically the smallest in the lumbar spine, so this form of stenosis occurs most frequently